Good morning, all. Am I audible? Great. Good morning. We are starting with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदली से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. Giving tribute to our great master, Samuel Hahnemann, for this divine science to all of us and taught us dare to be wise. Seeking blessings from our Guru, Dr. Prafull Vijayakar, sir, who made this divine science and bridged it with modern science, made it easy with mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakaraaya Namah. So friends, we are in the journey of reading Organon of Medicine's aphorism practical part along with the Verbatim, the workshop conducted by Dr. Prafull Vijayakar in 2002. So up till now we have covered aphorism 93 in a chronic disease when some disgraceful cause has to be found out, it has to be found out in a private. So we have find that thing. Now in aphorism number 94, what master's wisdom tell us while inquiry into the state of chronic disease, the particular circumstances of patients with regard to his ordinary occupations, his usual mode of living and diet, his domestic situations, and so forth, must be well considered and scrutinized to ascertain what there is in them that may tend to produce or to maintain the disease, in order that by their removal the recovery may be prompted. So this aphorism gives us the idea that we need to inquire into the causative factor of the patient suffering from where we have to find out. So we need to ask about what are the circumstances he has faced during his life, and what are the circumstances he faced during his living, in occupations, in domestic relationships, and we have to consider and scrutinize. That scrutinize means we have to interpret from the patient's perspective that how the person feels, how the person having the perceptions develop from that situations, and that is what we have to take into considerations. What master is telling us in case of a female. So this is what the aphorism which is given us for the female complaint, and especially in this case of sterility and pregnancy and miscarriage. Sometimes the female does not open up and they never tell about their this ailment. So in chronic disease of the female, it is especially necessary to pay attention to particularly the pregnancy, the sterility, the sexual desire, accouchement, miscarriage, suckling, and the state of menstrual discharge. With respect to this, the last name we have to about all the particulars of the menses, time, color, then the flow, then the mental or physical ailment associated with the menstrual cycles and everything, the pain and everything. So every accompanied symptom we have to find out when the patient has to be taken into consideration when the female patient is there. So sometime you will get the idea that in that case you will get the process. So I must remember one case of Dr. Prafull Vijayakar, sir, the lady having cancer, and in the past history she was having metromenoregia. So sir took one rubric from that, the metromenoregia in cancer. That was the case, and in that case sir has prescribed some remedy. So this is what something that you have to take into account, a certain point related to the menstrual cycles and everything. So this is you have to be very precise in each and every case taking when you are dealing with the chronic cases. In aphorism number 95, in a chronic disease, the investigations of the science of the disease above mentioned and all of others must be pursued as carefully and circumstantially as possible, and the most minute peculiarity must be attended to. Partly because in this disease they are most characteristic and least resemble those of the acute disease. So sometime whenever you must all have an experience that the patient when you are dealing with the case taking in a chronic patient, patient is giving whole history, and you will not get any PQRS from the patient. And at the end of the history case taking, the patient is telling you that I don't know it is important for you or not, but something which I got remember, and the patient is telling at last one PQRS symptoms, and that is what we can get the entry of that case. So many a time you experience this type of process. And if the cure is being effected, they cannot be too accurately noted. And sometimes partly because the patient is become so used to the long suffering, and they pay little or no heed to the lesser accessory symptoms. This lesser accessory symptoms is nothing but it is a PQRS symptoms, which are often very pregnant with the meaning. So this is has to be taken into consideration when it is in a chronic cases. Often very useful in determining the choice of the remedy. So this is what the PQRS, and regard them almost a necessary part of their condition, almost as health, the real feeling of which they have well nigh forgotten in their some 15 or 20 years of the suffering. So sometimes the patient forget, but patient is telling you that PQRS symptoms at the end of case taking, and they can scarcely bring themselves to believe that these accessory symptoms are these greater or lesser deviations from the health state can have any connection with the principal malady. So this is what we have to take everything in detail. So many a time in early practice of my early practice, I didn't get any PQRS from the patient, but still that we continue the learning of the SIRS. That SIRS gives the idea that whenever you didn't find anything from the patient, take a general rubric, and out of general rubric you enter into the disposition state, and then you can get the remedy. So it is not a hard and fast rule that in each and every cases you will get either a delusion, you will get either a delirium, you will get a very PQRS symptoms. It is the evolutionary process each and every homeopath gone through. So whenever you are evolving in the learning, then you will get the higher and higher facility rubric in your practice as well as in your clinical experience. So we will continue our reading of this verbatim, the workshop conducted by Dr. Prafull Vijayakar at Mahabaleshwar in 2002. So we are reading this, and up till now we have understood the approach to the skin disease from this book. Again, in the last sessions, we have understood the importance of the side affections. So whenever the side affections, and you will get an idea that a certain remedy is more probably right-sided remedy, certain remedy is more probably a left-sided remedy. So whenever you have a PQRS from this, you can get the idea that this remedy has to be in this process. So we will continue the reading from the chapter 11. So today's topic is again of a case taking. So how to deal in case taking whenever you didn't get any symptoms from the patients, then also you have idea. So let us understand the history taking from the predictive point of view and Dr. Prafull Vijayakar's understanding. So now let us come to the history taking. It is the same as taught in the college, nothing different. Do not think that my history taking is different. Take down the history according to what you have been taught in the college. I would like to make some additions that first of all we get two type of the cases. So we have to understand that what case comes to us. Either the acute case is there or the chronic cases. So we have to understand first two things. The case is one is the acute and the second one is a chronic. Essentially, the history taking is the same, but important shift with the types of the disease. The Hahnemann also has mentions almost two, three types of the history taking in organ one. Why? Because in the beginning, in the aphorism number 5, he mentioned that useful to the physician in assisting him to cure are the exciting cause, the fundamental cause, which is the miasm, the most significant point in the history that person's physical makeup of the persons, the moral, intellectual character, age, sex, and social status of that person. This is all everything written in aphorism number 5. In another aphorism number 11, he says that take into considerations the external reflections of the morbid forces within the body, and whatever changes have taken place are to be consideration. So these are the reactions has to be consideration. Again, he write that one has to pay heed to what the patient says and the observation made by the doctor himself. So in aphorism number 210, he says that there comes time when the same type of the history taking is not useful at all and take what is coming up the most. What is not seen is not to be treated. Give some medicines and the symptoms will change, and then again take up the history and again give some medicines and the patient proceed toward the cure. This is called as a zigzag cure. This is mostly in a one-sided disease. Why has Hahnemann talk about a different type of the history taking? We are using only one. It is essentially the importance which you have to give with the shift in the disease the person is suffering from. In that disease, how this particular constitution is reacting and what symptoms is it throwing up. So I have basically four type of approach absolutely based on organ. So this is what Sir's understanding is. Sora is expressing itself in the skin or the endosome, RS, respiratory, GIT, urinary, or even a hypersensitivity in the nervous system. There is something like an acute exacerbation of the chronic disease like a malaria, ulcerative colitis, tuberculosis, or epilepsy. And those symptoms suddenly came up because of underlying disease already being there, like an acute asthmatic attack. In a pure psoriatic inflammatory type, I use acute chart devised by Sir. In the above two, it is the constitutional simillimum with the acute remedy. The ailment is going to come back again and again. It will subside only for some time. So most of time, whenever you are treating the asthma, acute attack of asthma or ulcerative attack or epilepsy, in that case you can get some acute remedy. You prescribe episode subside again, the same episode will come, the same medicine will not work. So this is what you have to take into consideration, the constitutional simillimum when you get the recurrent ailment. Therefore, I have never used remedy like the Blata, Kaliars for asthma, Mercury, Leptendra for ulcerative colitis, or China Sulph or Ipecac for malaria without it being generally indicated. If it is indicated as a constitutional remedy, then it is must be used. But if it is directly we are using the therapeutic, then it is not working. So you are not treating the disease in man, but the man as a whole. So treat the man in disease, not the disease in man. When the man is attacked by an acute dynamic infection, which is so severe that it brings about the change in the whole constitution, maybe a short lasting and it will end in death or a recovery. So sometime when the person is affected by some dynamic acute affections, it may be short lasting or sometime it may end into death or recovery also. So if it is end in recovery, well and good. The most of time when the infection is not so severe, for example diarrhea, suppose someone had food in the market and develop diarrhea the next day, you need not take arsenic, waterphylum, pulsatilla, naproxen, or aloe to control the diarrhea. It is a reflex defensive mechanism of the body to throw out toxins by promoting motility. This is purely a psoric. So via sora, the body is trying to throw the toxin unless if the infection is so severe that you are dehydrating. There was a very good advertisement on the Doordarshan TV. Do not treat your child for diarrhea before taking him to doctor. Supply him with the electrolytes. So this is what very important understanding. Even allopath knows that. If this diarrhea does not come under control within 24 to 48 hours, then take him to the doctor. Diarrhea, dysentery, cold, cough, fever, all are self-limiting disease because the doctor within you is trying to eliminate the toxic materials and trying to balance your body. But our friend of the other contemporary science treat the diarrhea to stop the motility. You are collecting toxins within and not allowing them to exit. So also do not give arsenic, etc. Have you waited for it to stop? So be careful. In acute cases, sir's prescription is something that do not prescribe is the law in acute. Whenever you find a pure sorry cases. But mind well, you have to keep the watch on that. If the patient is going toward the exaggerations or sorrow-syphilitic, and then you must have to intervene with the patient. Tell the patient, okay, by tomorrow you will be fine and give sackless. I know vital force is at work. Why should I interfere? The human being is a sanctum sanctorium. When the defense fail, you are justified to help the body's defense mechanism. The cure is faster with the sacleg than the arsenic albor, podophyllum, etc. So practice become easy and we have to use less brain. So 90% of the time it works. These are very useful tips. So what sir has said that in acute disease, the first law is do not prescribe. He who is a minimum prescriber is the best homeopath. So this is what very important tip in specifically in acute. But mind well, you should be well aware of that the process is going on. Sorry. What is the man's constitution? So it is something that you have to understand. Human being is made up of the Panch Tattva or the five basic elements. Since we are dealing with the man, we need to know what is the man's made up of. The basic elements are the energy, earth, water, fire, and air. So energy stand for the activity. Air is represent the mind because the books of reflexology say that air and mind are the same. Fire represents the thermal, the heat developed due to metabolic activity regulated by the hypothalamus. Increased heat causes increased sweating, as a result of which the body cools down and vice versa. Excessive metabolic activity gives rise to increased heat within the body. If this is not radiated outside, all the organ will get destroyed. Therefore, Adam will have to adjust this metabolic activity in such a manner that he does not accumulate fat. Therefore, he is lean, thin, and emaciated, though he eats well. While in Katyria carb, the heat production is less. Therefore, their metabolic activity is so adjusted that they have excess fat deposition in repertory. In repertory, most obese people are the chili. So, how it is? Mathematics. In repertory, it is given that most obese. So when you go to the rubric obesity and you find the most of the remedies are chili remedy because they have to conserve the heat and they want shell and protections of the fat layer. That's why the heat has not been go out or used up. The same thing happen in the thirst. The water is represent the thirst. When water utilizations in the human body is excess, then everything dries up and you feel thirsty. On the other hand, if less water is utilized for a metabolic activity, the water level is maintained optimum and the patient does not feel thirsty. So this is what the water is. The earth symbolizes the physical material human body and the physical symptoms. The air is something which we need for the communications, something which can go to any nooks and corners where we cannot reach. Similarly, the mind is necessary for the communication. It can go anywhere where we cannot reach. If you can get representation of all this, your prescribing become very fast. When some disease attack you, the body has to fight it out. How much energy this constitution is going to utilize depend upon his constitutions and whatever is left out will be his activity. So if sorry if too much energy is required to fight out the ordinary cold and coryza virus, the patient will become dull, drowsy, and sleepy. At the same time, if not much energy is required and body says I can fight it out without more energy, then the activity will be good. Based on the activity, thermal thrust, and if there is any physical or the mental changes, we prescribe on this. So this is what the acute presentations. Therefore, Hahnemann has given aphorism number 7. Take into account the change in the body in acute disease. These are the representative of what is wrong within the body. So something which have to find out what is the deviations in the state of persons in a healthy condition from the healthy to disease, especially in acute cases. So the genes are the same, the expressions is changing because it has to fight. Every time the persons throw one particular acute, mostly in it relation to the chronic one. For example, this was the sir's understanding. For example, the sulfur developed diarrhea, it will be of a aconite or of a pulsatilla or arsenic, or it can be sulfur itself. Not necessarily that every time it will change. Therefore, first is the activity, second is the thirst, and add to it the finer point. This will be the implied demonstrated by Dr. Vijay Shah. I am not going to take. So this is all the theory of acute. So we will read this book, Theory of Acute, and how to apply into our practice in later sessions. Now, so this is for the acute condition. So this has to be taken into consideration for the acute case taking. Now we have to find out the genetic constitutional simillimum. So when we have to find out the genetic constitutional simillimum, here the mind is more important. So mind is divided into two parts. The basic trait from the genes that we are born with and our emotional reactions. This natural genetic trait may be conscientious, timid, cheerful, etc. Someone had asked me, why are you taking this? These are not the disease character. Do not take only emotions like anger, anxiety, or hallucination, delusions, or rare things. We have to see whether the patient is in a soric, psychotic, or a syphilitic state. In a chronic, if the patient is more in the psoric sphere, we are bound to take more of the psoric rubric. When the disease changes to the psychotic and syphilitic, then take psychotic and syphilitic rubric accordingly. So this is what Sir's understanding. So natural traits are very important for us as they come up from the genes, and genes make the mean. So that's why the natural trait has to be taken into considerations. The basic trait from the genes we are born with and our emotional reactions. Now, the protein which are expressed are the cause. That means our body is made up of the proteins. It can be a humoral protein or the structural protein. The structural protein gives rise to a structure of the body. Humoral protein gives rise to functions of the body and sometimes the neurochemical changes. So in neurochemical changes, it gives rise to emotions also. So whenever some protein has been changed because of protein imbalance, because of some trauma, and this protein is expressed, and that is the cause. So if the genes are not on, they are not expressing, and vice versa. If genes are on, they are expressing in certain protein. So I give most important to the expressiveness and not non-expressiveness of the patient because some genes are expressive and some genes are non-expressive. So sir took most of time the consideration that the person is expressive or person is non-expressive, and that is what the extroverted and introverted is. The way he comes and talks to me, aversion to company, and the introvert is a different. So that is what we have to take into consideration. Again, in a mental aspect, so wheel is the innate characteristics, whether positive or not, metallic or non-metallic, sensitive or right or left brain dominant. As we saw in Dr. Mehta's case, the patient approach was positive everywhere. In spite of his disease, his blindness, he was not scared. This is very useful in finer differentiation of remedies. For example, suppose you have a calcarea carb and nux vomica, both are chilly, thirsty, but calcarea carb wants support and nux vomica is positive. So this is the disposition is most important. So will is giving you a disposition. This is what Hahnemann talked in aphorism number 211. Do not give pulsatilla to nux vomica dispositions or aconite to the pulsatilla disposition. Aconite and nux vomica are angry, strong, violent, and positive, and pulsatilla silicia are not aggressive remedy. So, how can you confuse a slow, sluggish, fat, flabby Calcutta carb whose voltage get open slowly? You pinch, and after some time he says, ah, with a Kali carb who startles so easily at the slightest reaction, though the mentals are the same. So this is what you have to take into consideration. Now we come to the intellect. Howsoever the disease or the symptoms or the mind, body, general, physical matches to that of say Nux vomica or Mercury. But if I find the intellect is very low, he cannot understand what I am trying to say or has never been able to pass nicely or he cannot use his brain at all, I cannot give him Nux vomica, ignitia, or any other intelligent remedy because his intellect is dull. I have to search for some Baraita or a Buffo. So this helps us to differentiate the remedy. My materia medica is other way around, not from the book, but from the repertory. So you see different pictures of the same remedy. You have a combinations of the different rubrics which gives you the same remedy. So this is what Sir has made a genetic material from the repertory, and that gives you idea that how the person is behaving. Next is the moral father, mother, teacher who is bringing you up is always on the lookout whether you are going to get good morals or not. No father wants his sons to become bad unless he is a frank syphilitic. Then there is a defenses. These are very important. Every cell wants to survive. So the right from day one, it utilizes all its character to form a defensive attitude. What will be the psoric defenses? Anxiety, irritability, apprehension, anticipation, etc. What will be the psychotic defenses? The fear, rationalizations, cowardice, deceitful, haughty. People build up a strong shell around them so that no one can see their real self. And the syphilitic defenses are the escapism, impulsiveness, the eccentricity, the defenses that are out of his control. These defenses can be understood from the miasm and that can be understood from the disease that he has come with. Say the patient has come for the cancer or a Parkinson, do not take the sorry grumbling like the anxiety, health, appreciation, anticipations, or irritability. Take some syphilitic rubric like a frivolous, eccentricity, shameless, etc. Only then you will get the right picture. So this is very important. The defense are the most important things. So unless and until we know the which defenses patient is coming up, and so that we have to utilize a tool for that with the same defense mechanism. Find out the organism is defending himself mentally and physically, inflammation, thickening, or destruction. Also find out what is so peculiar in the defense. For example, beginning of the all disease is inflammation. In this stage, the pick up the anxiety of the health, future, money, etc. Then the thermal thirst, disposition, will, intellect, moral, and go and behold your remedy comes up. The result will come if you approach is very important line is result will come if your approach is right. So if your approach is wrong, result will not come. Try to find out the defenses of the patient. Next, the speed. Very important understanding is speed. Speed also comes out of the miasm, the energy from the resting and the action membrane potential. If there is a lot of calcium outside in the extracellular fluid and the impulses are not carried fast, the person becomes slow and dull. On the other hand, if more of the potassium is there in the extracellular fluid, sodium goes inside and potassium goes outside, you will get the fast impulsive persons like the Kali, Nux vomica, tuberculinum, agaricus, mercury, and the fast, and the Baraita and Calcarea are the slow. But Kali is also given in slowness, laxity, spraining of the ankles, etc. Why? When the potassium goes outside, the sodium goes inside. This potassium has to return back in the cell. This will return via active force. The sodium potassium pump start acting and throw potassium inside. So if every time he is throwing potassium outside his nerve cell, it has to be thrown inside via the sodium potassium pump, and this require the energy. One is a passive gradient comes out, and after that you have to come inside. They require active energy, and that is what the energy is required, and this energy is utilized from the mitochondria, and the stored energy ATP is being utilized. So after some time, the weakness, the laxity of the muscle fiber ensues. See how everything is explainable. Why Kalis later on become weak, and why arsenic become weak and restless with the tossing about in the early stage only because of this action potentials. Speed can be differentiated the remedy. So mercury in psychotic phase is slow. In a soric state, mercury is lean, thin, and volatile. The natural urge, desire, and attachment is also come from within, like a love for the father, mother, animal, etc. Excessive urge for the sex, excessive gourmands, desire for amusement, etc. are also be taken into consideration. So here in will, intellect, moral, natural urge, desire, attachment has to be taken into consideration. Now the latter part is the sensitivity. I have seen most of the history is incomplete. All the food requires some salt. Sensitivity, attachment, natural love, tolerance are very important. The tolerance to the cosmic affection, change of the ether, wind, moon, sun, noise, etc. The first mental sensitivity is sensitive to the rudeness, reproaches, criticism, admonitions, humiliations, indignation, sad story, etc. So find out what is this constitution is sensitive to. Very important. Now the physical sensitivity is the say the eye sensitive to bright color, some remedies like a black, some like a red, etc. Nature. The another point is nature. Nature, some can faint at sight of the blood, some like moonlights, and some like a darkness. You never know where a strong sensitivity can comes up. Then hearing. The sensitivity to noise, the sad stories, to the music, to music ameliorates, noise causes pain in the whole body, noise causes startling, etc. So, eye, hearing, then sensitivity to the touch, the people who get startled at the slightest touch, or the people who get acute excruciating pain because of the slightest touch, then the desire, then another point, the desire and aversion, the taste, the next, the emotions. The emotion has the anger, irritability, love, hate, and the physical sign. All of them depend upon the miasm. So miasm rule the mentals and the physical characteristics, the structure, the physical reactions, the expressions of the disease, the physical generals, and everything. So here we have to consider everything. So in short, nature, attitude, tolerance, sensitivity, instinct, drive, intellect, likes, dislikes, everything is governed by the miasm. You have to pick up the most important things representative of the five elements like is the fire, earth, air, water, and energy. This is how we have to collect the data when the case comes to us. I would always like to know the chief complaint. For example, if the patient having a backache, I know what question to ask him to see the journey of the disease because it has to come back again. I have to trace the disease from where it started and where it went into psychosis. We do not get this every time. All reactions in a cell are the perfect balance. They are all interdependent and interconnected. Everywhere there is a protein involved, whether oxidation, reductions, etc., and the equilibrium is reached. As I told you in the case of cardiac block, this equilibrium is of his was disturbed. He was having antihypertensive, anti-diabetic, anti-gout, etc. When this equilibrium is disturbed, Guyton says immunity is disturbed and the man is called sick. The equilibrium is because of proteins. The proteins are involved in one way or the other in maintaining the equilibrium. Then only the disturbances in the protein will give rise to the problem in the immunity. All the reactions have protein as a base agent, catalyst, secretions, transmitter, etc. So protein balance is the health and imbalance is the disease. So this is what our understanding is. Protein balance is the health and imbalance is the disease. This dynamic equilibrium is called as homeostasis. So Guyton says every cell contribute to this and benefit from this. Mental and physical health depend on this. Hahnemann said it is a spiritual vital force, the dynamic that retain all the part of organism in admirable harmonious operations and keep the instrument healthy. What is the spiritual vital force? The physiology says it is a dynamic kinetic equilibrium harmonious in the biochemistry that gives rise to the immunity from the disease. So this is what the same both are. Is there an equation between the biochemistry equilibrium and the vital force? So try to find out what has disturbed this equilibrium. People says I drank a cold water, so fell sick, or lifted a bucket and got backache. But in the first place, why did the back become so weak? Why did the cartilage have some toxic protein which to make it weak? All these years he was lifting it. One fine day you come and tell me that this pillow has caused me neck pain. There is some toxic protein which has automatically gone there, and that is why your cartilage has impaired immunity and is showing the signs of inflammation. But prior to that, what had happened? Any fight or a quarrel at home? So based on this, I asked many questions. So what can disturb the protein balance and cause the disease? So this is what we have to ask about the cause. So whenever the patient comes to you with a complaint, so we generally ask certain questions related to the patient's complaint. So most of time, what can cause the protein imbalance? The first is the emotion, because of neurotransmitter like adrenaline, noradrenaline. When you get angry, adrenaline is secreted more, and protein balance is disturbed. In your most sensitive part will have toxic protein there. So same way with the grief, mortification, vexation, etc. In small children, it is mostly the vaccination, the physiological introductions of the protein. Any bacterial or viral infection, they die their own death inside and toxic proteins are produced. So my question is, what was the mental disturbance before this? Antibiotic, especially before the dental procedure, they kill the normal flora. Again, it can imbalance, produce the protein imbalance in the body, and then the disease has been started. Immunoglobulins, the protein which was given for the some immunosuppressions. Insect or animal bite or a bee sting, again that contains some proteins, a toxic protein, a poisonous protein. So I know of the patient who went into renal failure after a bee sting. So this was such case. And the trauma. So sometimes the trauma, the physical trauma gives rise to muscles has been destroyed and some proteins are released. So this is also gives rise to protein imbalance or food poisoning. So the exciting cause is important to know what can cause the problem in the man. Now, depending on the disease or the organ involved, you can find out the cause. So this is what and now what we are connecting with the GNM. Depending on the disease or organ involved, you can find out the cause. So the learning of the German new medicines gives the idea that if the kidney is involved, there must be some causes. Mental level is abandonment or forsaken feelings or refugee feelings and everything. So same thing, we have to keep ourselves updated with the questions that why this constitution is affected with this. Sometimes the patient may forget to tell you or is ashamed to tell you. If the patient comes with the diabetics or the tumor, it is not something which you develop after anger or fright because it is psychosis. So diabetes comes up slowly and gradually increasing. So ailment from anger and frights are the syphilitic. Severe rage sometimes which has affected the constitutions all destructive disease with the sudden onset start after anger and the fright. Now when the mother-in-law trouble her daughter-in-law and she develop a rheumatoid arthritis or a hypertension or a diabetes mellitus, this is psychotic. Continuous low cause. Anxiety, sadness, weeping or a suppressed anger can cause a psoriatic disease like a bronchitis or pneumonia. So now we see, so we have seen understanding of the case taking. So we have to take most of things, the physical aspect, then the mental aspect in the mind. We have to understand the will, intellect, moral, attachment, sensitivity, emotional reactions, and everything. So this is what gives rise to one of the understanding of the genetics of the man. So now let us have a case of a sir. So this case gives insight that if you don't find anything from the case, then also you need to prescribe the remedy and you will get the result. So this is what the sir's understanding. So this is the man who came to sir with the enlargement of the kidney and the hypertension. He is a Muslim, a motor mechanic, and would also do some welding work. A poor man. His blood pressure when he came was 210 by 110. So it was a malignant hypertension. Though he was informed about his blood pressures and medicine was given to him, he was not taking the medicine. So he is not concerned about his disease also. So very what we think about this, the syphilitic disorders, and he is not taking medicine. So he must be a heedless, he must be a careless, he must be a frivolous kind of constitution. He was absolutely not bothered about his hypertension. Again, the frivolous, he came up with the enlarged kidney since 3 years and the hypertension. He complained of pain in the left side of the abdomen, better by the hot fermentations. He was treated for the gases in the abdomen. When investigated, he was found to have a hydronephrosis of the left kidney and the medical renal disease. So, just by looking into this, so sir asked, what was the things happening before 3 years? What was the first symptom you developed and how it started? So this was the things usually we ask to our patient that how it started and what were the things. So ailment. So 5 years back he fell from the second floor of the building when he was welding a window frame. He fell down on the sand which was stored for the construction purpose. He just got up and walked up the staircase. So this is what he fell from the second floor on the sand. and then he walked up and get up and walked to the staircase. That day it did not pain him, but he started getting aches and pain all over the body in the next day. He went to the doctor, took some medicines, and it became all right. But the pain in abdomen was never better. Gradually, he lost interest in the work. He had no desire to go to his work or do anything. Now he became dull, even with the slightest pain. This was exactly opposite to his natures. He was a workaholic and very good motor mechanical. All the challenging problem used to be brought to me. Patient is telling like that. All the challenging problem used to be brought to me from other mechanics. When no one could repair or find a fault with the engine, they would consult him and he would always be glad to solve the challenging problem. Loves to be in a cool weather. So someone who was so industrious, so workaholic, suddenly started becoming dull, lost interest in doing his daily work, and he is aversion to hot weather and not comfortable in the heat. The thirst is okay. He eats anything that is given to him, no likes or dislike, very contented. He has been constipated ever since he got this pain. So this is what again one point. He has been constipated ever since he got this pain. My work has suffered. I cannot give my best in the workshop. Anyway, I have to die one day. So what? Rest of all is fine, no problem, no anxiety about his kidney problem at all. So this is what, be careful. A hypertensive patient, a huge kidney, a big kidney, a hydronephrosis, and he has no worry about his kidney problem. He says that one day everyone has to die. So what? Rest all is fine, no problem. So what symptom do you get here? These people from this socio-economic class are already in the psychotic environment. He is a concealed, not ready to give any mental pictures. See, sometimes you didn't get any mental picture from the patient. So how can you approach this case? This is what Sir's understanding. So you have to learn from Sir's process. So psychotic environment, he is concealed and not ready to give any mental picture, not positive, ready to die also. So psychosyphilitic miasm. Now let us see his report. So in 1998, USG abdomen was done. So liver, gallbladder, pancreas are normal. Gallbladder distended well. The right kidney shows the normal corticomedullary echoes and central collecting system. There is no evidence of the focal solid or cystic mass, hydronephrosis or calculi. Renal space are clear. Right kidney measure about 13.6 centimeter by 4.6 centimeter. There is a compensatory hypertrophy of a right kidney. The left kidney is enlarged with a huge hydronephrosis occupying almost the left flank. It is not the right flank, it is a left flank. Printing mistake. And pushing the abdominal structure contralaterally to the right side. The left renal parenchyma is thinned out. The density at the pelvic junctions could be a calculus. The left kidney measure around 32 centimeter by the 15 centimeter. So Dr. Vijayakar says, I have never seen such a huge kidney in my life. Kidney KUB, X-ray KUB or US KUB shows that there was a ground glass appearance of the left flank area, which could be due to the fluid filled structure, query hydronephrosis. There is no evidence of any radiopaque density in the visualized area. Active renal functions of the kidney is 96 and the left kidney is 4%. So right kidney is 96% working and the left kidney is only 4% working. So Dr. Vijayakar, so we can even visualize the left kidney that is purely a psychotic, a huge kidney. KUB in 1999, the left kidney is not visualized at all, but a big cystic mass is seen extending from the left hypochondria to the left iliac crest and the epigastrium. No renal tissue visualized at all, left ureter also not visualized. So this was the report shows. Blood pressure 200 by 110. So now what to do? What do we do? How do we proceed in this case? The ailment from most important and how did it start? So again, How, sir, infer the case that it start with the fall from the height? So it started after the fall. He is the constitutions who can have or suffer from the constitutional effect of the fall or injury. So certain constitutions are sensitive to the fall or injury. They will suffer a longer time. So this is what this constitutions having the effect that is effect from the fall or injury. Again, the remedy is left-sided. He is hot, and the point thinks this, even though he had hypertension of 200 110s or having a huge kidney, he is not bothering about his disease. One day I will die. So this is what something that sir think is, it is indifferent to even disease also. Want of sensitivity in most chronic disease, the patient going toward the death are indifferent toward their health. So this is what the syphilitic entering. The more difficult the case, he would solve it. So I want a remedy which act best in the case of difficulties and crisis. So how the person, the mechanic persons who is solving everything in a difficulty and crisis. So this is what the mind of person is, something that he is the person who is working in a difficulties and crisis. He is contented and better in the thunderstorm. So on the basis of these dispositions, and Sir took a repertorial totality of this, and Sir prescribed the Balis perennis 30, a single dose. So Clark mentioned about Balis perennis, there is a fag. This is the most important things of Balis. Uh, Tiredness does not work, dull and lethargy. So after injury, the goes into a tiredness, does not work and lethargy. So same thing happen in this patient also. There is a stasis like all carbons. The patient has a mild, soft, not aggressive fighting ability. He was positive in his ability to work. So this was the word of the Clark. The stasis fag growth after injury, and he loves thunderstorms. So the remedy prescribed was Belispur. So sir giving a Belispur 30 somewhere in January. This man was so indifferent that he would just come and take SL and go. He resumed normal work in the February within 1 month. So his blood pressure was still high. In May it was 180 by 100. In July it was 160 by 100, and in September it was a normal 130 by 90 with just one dose. But I am not interested only in his blood pressure coming down. Let us see what happened to his kidney. So it was the USG done in July. The left kidney measures 16.3 centimeter by 7.9 centimeter, half the size straight away. So it was a 35 centimeter to the 16 centimeter. Now the size changes from the 16.3 centimeter to 7.9. So half of the size. Multiple anechoic area are seen. There is a marked thinning of the renal cortex. Previously, cortex was not even seen. Tubular anechoic shadow is seen, and this suggests either dilated lower left renal pelvis or dilated ureter. So here the dilated ureters are found. There is no evidence of left renal calculus. So calculus is not there. So another USG done, the left kidney measure 19 centimeter, the pelvis is dilated, the upper part of the cortex is visible. Previously the cortex is not visible. There is query calculus, query narrowing. Why? This is something that you have to keep in your mind, because this narrowing and the trauma, the calculus can produce a hydronephrosis. So there is a query, it was written in the query. Unfortunately, this patient has suffered an injury at the pelvic junctions. Therefore, there was a narrowing and the hydronephrosis. So trauma, a blunt trauma to the abdomen or the back that goes directly deep into the kidney or ureter, and that create a constriction, and that is why the remedy which is having a trauma, deep injury or a deep trauma, that's why the Balispar is again the indicated. So USG dated on October. The left kidney is very much present. It reduced to the 13 centimeter, and then mere was compensatory hypertrophy, and it increased to the 19 centimeter. The left renal parenchyma is not visualized at the left renal fossa. Grossly dilated anechoic lesion with the septa would suggest gross hydronephrosis. The left renal pelvis is dilated and there is a density at the pelvic-ureteric junctions. It could be a calculus or a narrowing. So left kidney measure 19 by 6.4 centimeters. So this is something that from the huge kidney 35 centimeter to the 19 centimeter within 10 months of the span. Now, Dr. Vijayakar comment on this. Why we saw that the fluid disappearance and the cortex was also visible. Last time also they said there is something in the ureter which is seen, and now they say there is no calculus. It could be a narrowing. So then it went into psychotic, the fluid field, no inflammation. Why did the patient go into this tumor formations? The injury was exactly at the ureters, which got inflamed and it blocked the kidney, and then there was a accumulations of the fluid and it became a huge psychosis, which was absorbed after Bailey's per prescription. Therefore, the psychosis disappear and the inflammations or narrowing of the uterus still remain. Now it is going to natural hydronephrosis, and next it will open up and everything will be normal. But I do not know whether functioning will start or not. But his huge kidney from 32 centimeters by 15 centimeters, pressing everything apart, has come down to almost normal size. So this is something has been changed. In follow-up, August 2002, the pain in abdomen and weakness is much better. The stamina is good and desire to work is there. The stool is much better, body ache reduced, and his weight is better now. This patient had weight loss previously. When psychosis increase, weight also increase. Again, it is something that you have to correct this in the book. Okay. We should know how this psychosis should go and what should come. I never imagined one dose of Belisper could bring such a huge kidney to the half of the size. The second dose of Balis was given in May 2002. So this is what the end of the case. Whenever you didn't get anything from the case, you have to infer from the case how the constitution is behaving and how the miasmatic progress of the disease has been start after the JOD. So just by understanding this, there is a deep injury to the abdominal content by blunt trauma, and that produces a accumulative tendency in the body, and that is what the huge kidney is. So by giving that remedy, the ballast per, and all the fluid has been absorbed and it become normal. So this is what how sir has beautifully narrated this and give us the idea that whenever you didn't get any mental symptoms, you can go through this way also. So this is what our understanding of this case. Hope you all learn from this and enjoy from the learnings of the sir and the wisdom of the sir. And there is one question someone has asked. In yesterday's lecture, in a previous chapter, we have read in the last para the right-sided sensitive is soric, and if psychotic, it is left-sided. This is in relation to the lycopodium only, not in each and every cases. This is the case of lycopodium. So this in that case, lycopodium is like this. Lycopodium go from right to left, whereas lecasis go from left to right. So in right-sided lycopodium is sensitive and left-sided is not so. So it is related to lycopodium only, not in each and every cases. Hope you got it and hope you understand it. So we conclude the day today. So thank you so much. We will have question answer sessions in, I think, in this end of this month or most probably in the next first Sunday of next month. So we will have another question answer sessions which remain. So we'll conclude that. Okay. And yesterday I share the link of question answer sessions and approach to all the disease which we have taken in our Happy Gujarat team. So go through that videos and so that you will get all the idea in your clinical practice. Yes, yes. Dr. Nisha has said a very good rubric that sometimes when the patient is going from the right side to left side and the complaint going from the left side to right side, you can use the generality rubrics side left then right, or sometimes side right then left. So this is what where wonderful rubric you can apply in your practice. Even there is one rubric, there is a side crosswise. You can also apply this rubric in upper part, left upper part and right lower part, or sometimes the right upper part and left lower part. So this is what you can apply in clinical practice. Yes, diagonal, side diagonal. Great. So that is something that is very important. The physical rubric is more important also. It is not necessary that every time you can take the mental rubric and you can get everything. Sometimes the physical entry point will give you everything. So thank you so much. We conclude our day today. Thank you all. We will continue this journey. Thank you.